Welcome to Deny Delay Depose. Health over wealth.
Hey everyone, glad you're tuning in.
Hello, listeners.
All right, so let's jump right in. We've been circling around this for a while now. This whole idea of how messed up the healthcare system is and how it fuels so much anger and distrust. And I keep thinking about the Mangione case and how it's just this glaring symptom, right? Like a boil that's burst open, revealing a deeper infection.
Totally, I see it as a radical inflection point. Like the system is so deeply broken that people are starting to see extreme measures as, well, not necessarily right, but understandable. Mangione's a martyr in a way, a tragic one, sure, but a martyr nonetheless. I mean, the man's actions, while obviously not ideal, they represent the frustration of millions.
I get that. I understand the sentiment and that people feel that way, but I think, to just call him a martyr, that's a bit much, isn't it? I mean, violence is never the answer, and it's dangerous to start painting him in that kind of light. The system is far from perfect, I agree, but it's still the best we have given the economic and social constraints we operate under, right? I mean, capitalism isn't perfect, but it drives innovation and progress, and we can't just throw it all out the window.
But that's the problem, isn't it? That phrase, the best we have. That's just accepting a broken system. Innovation and progress for whom? It feels like it's mostly for the insurance companies and the pharmaceutical giants, and not for the average person who's drowning in medical debt or can't even get the basic care they need. It's like we're optimizing for profit, not people.
Exactly, and it's that optimization of profit that's creating this mental health crisis alongside the physical one. People are so stressed. They are filled with anxiety, fearing the next bill, the next denial of care. And that constant level of stress is having physical and mental implications. It's this constant feeling of injustice, of being a cog in a profit machine. It's dehumanizing. The Mangione case isn't just some random act of violence. It's a culmination of that injustice. It's the sound of the system creaking under its own weight.
I don't know, that feels a bit overly dramatic and, to be honest, overly simplistic. Yes, costs are high. No one is denying that. But healthcare is complex. There's research, development, staffing, facilities, all of that costs money. And it is absolutely true that some bad actors exploit the system, but that doesn't mean we burn it all down. I mean, we have some of the best healthcare in the world, right? The outcomes, innovation. It's just that access and cost can be challenges that we should work on within the current framework. Incremental change, that's what we need.
Incremental change? We've been doing incremental change for decades, and things have just gotten worse. The costs keep going up, people are getting sicker, and the insurance companies are posting record profits. It's like we're fiddling while Rome burns. I mean, look at the South Korean situation. You've got a president trying to use martial law, what a wild concept in 2024, to override what he perceives to be an opposition to progress. It sounds so familiar. It's not a direct parallel to our healthcare system, but it's that same kind of desperation. The same kind of feeling that the system isn't working and that you have to take extreme measures to make a change. I feel like we're not that far off from a similar crisis here if we don't make some real changes.
Yes, and it's not just about monetary cost, right? It's the human cost, the stress, the anxiety, the feeling of powerlessness. That's what is fueling this discontent, the mental health crisis that's intertwined with the healthcare crisis. People are becoming increasingly desperate. I think what we're seeing with the South Korean situation, and it is wild, is this idea of systems being so rigid and immovable that someone feels like they must take extreme steps. Is it really that different from someone feeling like the medical system is actively denying them care while they watch their family member suffer? It's that same kind of frustration that things aren't working.
Okay, I get the frustration, I do. But let's not conflate a political situation with healthcare. The South Korean situation is about power and politics, whereas we're talking about healthcare delivery. It's not really the same. And, this idea that incremental change is useless, well, that's just not accurate either. Look at the advancements in medical technology, the research, the cures we have developed. That didn't come from a complete overhaul. It came from building on what we already had. We just need to fix the problems, make it more accessible and affordable. A lot of the discontent stems from inefficiencies, not just from the concept of profit.
But inefficiencies within a for-profit system are the problem. They're not bugs, they're features. When your main goal is profit, you are inherently incentivized to deny care, increase prices, and cut costs, even if it means sacrificing quality. That's the system we've created, and the Mangione case, and honestly, the South Korean protests, they're symptoms of the same disease. It's this feeling of being completely unheard and unrepresented, like the system is acting against you, not for you.
And there's this feeling that there's no accountability, right? These companies make billions, people suffer, and yet nothing changes. You have executives making insane money while people are losing their homes due to medical bills. That creates a deep sense of injustice, and that's something that will manifest in people's mental health. It's not just about having access to care. It's about having faith that the system is working for you. The South Korean protests, while political, highlight that exact same thing, the feeling that your voice isn't being heard, the government isn't working for you.
I mean, that's a really black and white view of a very complex issue. These companies are employing thousands of people, they're funding research and development, they are providing services that we need. To just portray them as villains, that's a very simplistic view of a very complicated system. Yes, there are issues with access and cost, and we should absolutely be working on those. But that doesn't mean we throw out everything and adopt some utopian model of healthcare. There are so many complicated issues involved in large systemic changes like that, we shouldn't take it so lightly and romanticize the idea that complete change is always the right way.
But the status quo isn't working, and that's the point. We can't keep patching a sinking ship. We need a fundamental shift. And it's not utopian to say that healthcare should be a human right, not a commodity to be bought and sold. Other developed countries have figured it out. They have universal healthcare systems, people don't go bankrupt because they get sick, and they seem to have better overall health outcomes. It is about looking at models that work and trying to figure out why they work and then trying to apply those lessons here. Are we so arrogant that we think our model is just perfect?
It's this refusal to acknowledge the inherent flaws in the system that's causing this boiling point. We're seeing it in the Mangione case, in the South Korean situation. These are not isolated incidents. They're all symptoms of the same underlying disease of a system that is not serving the people, and that leads to a deep, deep mental health crisis. The constant anxiety, the feeling that the system is actively working against you, that's going to take a toll. It will manifest in anger, depression, and even desperation. It's that hopelessness that fuels extreme action. And yes, violence is never good, but we have to understand the forces at play here.
Okay, but how do you explain that other countries, with even more of a universal healthcare model than the ones you're praising, have huge waiting times and lack of access to specialized care, especially in rural areas? I think we need to look at all the data and understand what they do right and what they don't. We can't cherry pick. And to say that all companies in the healthcare industry are simply evil and only after profit, well, that's just false. Some are actually doing cutting-edge research that helps people. Some genuinely strive to provide the best care possible. To paint them all with the same brush does a disservice to everyone in the field. This issue isn't that straightforward.
But the core structure is flawed, that's the point. Yes, there are good people working within the system and they are likely frustrated as well, but the fundamental profit-driven model is broken. And it creates these perverse incentives to deny care and prioritize profit over people's well-being. And that feeling of injustice and powerlessness? That's the fuel for the discontent we're seeing everywhere, not just in the US, but in places like South Korea too. We need to address that core issue if we want to see any real change. We have to shift from a system that is about making money to a system about providing health.
And this idea that we can just fix the issues within the existing framework, well, I disagree. I think the system is too entrenched and too corrupt, and it will always prioritize profit over people. The only way to make real change is through a radical restructuring of our healthcare system that prioritizes people, not profit. It's about creating a system where everyone has equal access to care and where the focus is on preventative medicine rather than treating symptoms. The mental health impacts of a failing system need to be considered, and those impacts are massive. That's why these kinds of things are popping up, from Mangione to the South Korean situation. The desperation is everywhere.
I think that's a very extreme approach, and it's not practical. A complete overhaul would be incredibly disruptive. It would cost trillions. It would have intended consequences that would be extremely hard to reverse. Plus, we would have to consider all the people who work in the industry, the economic impact. It's not as simple as just saying profit bad, people good. The world is far more complex than that. We need a targeted approach, focusing on specific issues like transparency and billing, reducing administrative overhead, and increasing access to affordable care, not just tearing the whole thing down. We need to acknowledge the good and fix what is bad. We can't just throw the baby out with the bathwater. And, to imply that people in the US are somehow uniquely frustrated is just wrong. People are frustrated with their governments everywhere, and that frustration manifests differently in every part of the world, the same way it did in South Korea.
But what you're calling extreme, I would call necessary. The system is clearly failing, and when a system fails, you don't just keep making small changes, you need a radical fix. The current system is a major contributor to the mental health crisis in this country. It's like this pressure cooker that's just building up. We are so conditioned to accept this as the norm that we don't even see how crazy it is. It's like the frog in the pot slowly boiling until it's too late to jump out. And look at the South Korean situation again. It's an example of how a broken system leads to drastic measures and a deep sense of hopelessness. What will our martial law moment be?
Exactly. It's that feeling of being trapped, of being completely powerless within the system. And that constant, low-level anxiety takes its toll. It creates a cycle where people are so stressed about healthcare that it is actively destroying their health, both physical and mental. And yes, of course, the South Korean situation is different. They are dealing with political power, but the underlying issue is the same. A system that people feel is broken and that they can't change through the normal means. It's that feeling of injustice that drives people to extreme measures, be it protests or, in the case of the Mangione, acts of violence. Again, violence should never be considered good, but these reactions are symptoms of a much deeper systemic sickness.
But are we going to get anywhere if we keep romanticizing this idea that the system is irredeemable? That's so counterproductive to any rational discussion. And to keep using the Mangione case as some sort of symbol, I think it's irresponsible. Violence is never the answer, and we shouldn't start framing it as some sort of heroic act. Yes, mental health is connected to healthcare, but we need to look at the root causes of mental health issues, not just the symptom of the healthcare system. I mean, there's socioeconomics, genetics, personal relationships, and so many other factors. Healthcare is important, but it's not the whole equation. Plus, we keep focusing on the negative, but think about all the good the healthcare system is providing to millions of people every day. The surgeries, the medication, the research, it is not all doom and gloom.
But we cannot ignore that the system is causing harm and that the constant fear of financial ruin or being denied necessary care is having devastating effects on people's mental health. And it's not just about access to medication or therapy. It's about addressing the systemic issues that are causing people this stress in the first place. We can't keep treating the symptoms without addressing the disease. It's like putting a Band-Aid on a gaping wound. In the South Korean situation, it is important because it shows how frustration with a perceived unfair and unaccountable system can boil over in different contexts. It is about understanding that people will act out if their voices are not heard. And that is where we completely diverge. I think that is exactly what is not working. Incremental changes within a broken system. We need to go deeper than that and question the core structure itself. It's not about just fixing some bad practices or making things a little more transparent. It's about realizing that the whole thing is fundamentally flawed and that the prioritization of profit over people is the root cause of the problem. We need a system that is built on the principle that healthcare is a basic human right, not a commodity. The Mangione case and the South Korean example, and frankly so many other examples, they're all wake-up calls. We need a fundamental shift, not just superficial tweaks. This is about people, not profits. And that is exactly the point. We need a fundamental change in how we see healthcare.
Right, and we are ignoring the incredible damage this is doing to our collective mental health. The constant anxiety, the constant struggle to navigate this incredibly complex and predatory system, that's taking a toll. That's not just a minor inconvenience, it's a major crisis. And these are not isolated incidents, it's a systematic issue. We are seeing similar patterns of frustration and discontent play out all over the world, and that should worry all of us. And while I agree with you that violence is never the answer, the idea that we just ignore the conditions that create this level of desperation is equally dangerous. This is an opportunity to rethink everything and finally move forward in a way that is equitable and just for everyone.
But the data shows us that the current system is failing, and that this is an extreme situation. It's costing us our health, our well-being, and I firmly believe that the longer we delay in making actual fundamental changes, the worse it's going to get. We need a total system overhaul, and we need to move away from the profit-driven model. The Mangione case should be a major catalyst in reevaluating how our healthcare systems work. Instead of dismissing it, we need to ask why and what can we do to make it better for everyone. The South Korean situation highlights this point perfectly. The lack of representation of people leads to extreme measures. It shows that there is a breaking point. And in our context, that breaking point is our healthcare system.
Exactly, and this is about more than just healthcare, right? It's about our values as a society. Do we believe that everyone deserves access to basic healthcare, or do we think it's just another commodity to be traded? And this is where the mental health crisis ties in so fundamentally, because a society that disregards people's basic needs, that creates a system that is actively working against them, that's going to breed anxiety, depression, and hopelessness. The Mangione case, and even the protests in South Korea, should be a wake-up call. They should push us to ask some uncomfortable questions about what kind of society we want to be.
But again, the system is broken, the data shows this. An incremental change isn't going to solve the problem. We need to fundamentally change the way we think about healthcare, moving away from a profit-driven model to one where the focus is on the health and well-being of people. And the Mangione case, and again, the situation in South Korea, they highlight the dangers of ignoring the voices of the unheard. When people feel like they have no other recourse, they will resort to extreme measures. And we as a society have to take responsibility for the system that created that situation. We need real change, and we need it now.
Yes, and when you create a system that actively harms people, it is absolutely going to impact their mental health. You cannot separate the two. The constant stress, the fear, the hopelessness, that's the reality for millions of people. And the South Korean example is a perfect analogy. Albeit on a much different playing field, it is the feeling of powerlessness, of being ignored, of being actively harmed by the system that is fueling these movements for change. That's why we need to address the core issues, the systemic problems, the model that is simply not working. And yes, violence is not good, but we must understand that these are not isolated incidents. They are symptoms of a system in crisis. We need to move beyond the status quo to something fundamentally better.
And that's where we differ. I believe we need a paradigm shift, a complete restructuring of our healthcare system that prioritizes people's well-being over profits. The Mangione case and the situation in South Korea show us what happens when we ignore the voices of the people and when a system is perceived as unjust and unresponsive. It's about fundamental change, not just superficial tweaks. That is what I believe we need.
Totally, and I firmly believe that this is not just about physical health, it's about mental health as well. This system is creating a crisis of despair and anxiety, and it's actively harming people. We need to create a system that is fair, equitable, and that supports the well-being of everyone, not just the wealthy and the privileged. And that is only going to happen through real change, not just a bunch of cosmetic fixes. I think that's what we are seeing in so many other places now, and that is a signal to us that a new way is needed.
Well, I guess that's a good place to leave it for now. We clearly have some differing perspectives, but hopefully, this conversation has shed some light on the complexities of the issues. We have to keep talking about this until real changes are implemented.
Yes, thank you to all of our listeners. Let's all work towards finding constructive and practical solutions and a reasonable future for everyone.